Okay, recording. Okay, so we're looking in the medial compartment. We're just getting started here. And on this medial side, we're getting a good look at the meniscus here below. Here's kind of the medial capsule. We can see there's some degenerative change on the condyle, but not bad. I haven't seen any loose bodies yet, so that's encouraging so far. So we'll look next in the central part of the knee. This is where the anterior cruciate ligament is. There's the graft. That graft, just like the imaging showed us, that graft looks good. Really don't see signs of any problems with the graft. Your knee was stable under exam. Just going to rotate the camera up a little bit so we can see it like that. That looks good. That's a pretty good look at a revision anterior cruciate ligament. All right, so we're going to stop there. We'll go ahead and look in the lateral compartment next. Okay, so this is the lateral compartment. And again, we're seeing some areas in the cartilage on the femoral condyle that are pretty soft and pretty flexible, friable, meaning that they're flaking off. I still haven't seen any real loose bodies yet, and we're just working on the edges here. As far as this lateral meniscus goes, we'll trim this a little bit with a straight basket forceps because there's some little tears here. Let's see if we can't show you that here. Put the blunt in there, please. Okay, so we're just trimming out this little part of the meniscus that's got this tear here. And that now looks pretty good. There's a little bit more in the body here that we need to work on. I'm going to rotate the camera around, and we'll have a look right here. Do you have one that cuts to the left or turns to the left? We'll show you some more in just a minute. Okay, so now we're just kind of fine-tuning the partial meniscectomy here. The trick here is to take away as little as possible. So I think we're done on the lateral side. Do they make a slightly more aggressive shaver than this?
Yes.
Okay.
You like this style?
Not right now, but in the future. Okay, so we're done with that. We're going to go ahead and see if we can find any loose bodies. So far, we haven't really seen anything. Just this cartilage that clearly is getting chipped away and generating loose bodies, but haven't seen anything big to worry about yet. Okay, so now we're looking in the medial gutter. And with a little bit of suction, there's clearly nothing floating down here. That's great. We'll come back up. We'll come back up here and look over in the lateral gutter in just a minute. So this is the lateral gutter. There's one little loose piece there. We'll get that in a minute. But as we pull down here, this is pretty clear. So that's encouraging also. So now let's get back up in the suprapatellar pouch, which is where we are here. We'll see if there's anything loose to worry about. And if not, then I think we're going to be done. So you can see there's some areas on the patella up above that are pretty soft. So not crazy about seeing that, but there's really not much to do other than just to shave this little part right here. And then the cartilage on the lateral facet looks a lot better, a lot smoother, better shape. So I think we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.